Hello and welcome to As Prescribed. I'm Kathy Novak. Bypass surgery is one of the most common heart procedures, and it's usually associated with very long recovery times, but there could be less invasive options. Joining us today to talk about these options is Dr. Tom Nguyen, Chief of Cardiothoracic Surgery at UCSF and Associate Professor of Surgery at UCSF, Dr. Rodrigo de Souza. Welcome to you both.
Thank you, Kathy.
Thank you for having me.
So Dr. Nguyen, I might start with you. Tell us about what other options might be for people who have to have bypass surgery.
No, absolutely, Kathy. So the most common ailment that folks need done by us is coronary bypass surgery. It's the most common operation that we do. But interestingly, it's probably the most common operation that surgeons probably don't do correctly. There's a lot of data that show that when you do bypass surgery, you should use both mammaries on the patient's chest wall, both internal mammary arteries. And there's also a lot of data that we should do it in the least invasive way possible. And if we can get away without having to crack the chest open and do a minimally invasive incision, patients should do so much better.
So Dr. de Souza, how do you do heart surgery without cracking open someone's chest?
Sure, a lot. And the most impressive aspect of this surgery is that when we talk about recovery times, because as we do not have to crack anyone's chest, and you can perform the same surgery that we do with an open chest using just 2.5 inches incision, and it makes the patient to get full recovery on 10 to 15 days only. It's really an advance.
10 to 15 days, Dr. de Souza, compared to how long would the recovery times usually be?
12 to 15 weeks.
Okay, so that's a much shorter recovery time. So a small incision, Dr. Nguyen, what's actually happening inside that incision? How can you go from cracking open someone's chest, stopping their heart, to this minimally invasive procedure we're talking about?
Yeah. So our goal is that we just want to expose the area of interest where we need to operate on. And you can do that through the small incision. A lot of times when you do the big incision to the front of the chest, you have a lot of parts of the heart that's exposed that really doesn't need to be exposed. So that's how we do it. We do a small incision. We expose exactly what we need to expose. And a lot of times you hinted at it, we could do it with the heart still beating without having to stop the heart at all. So kind of the whole beating heart concept that has a potential benefit for a lot of patients.
So then, Dr. Nguyen, why is this not being done more? This sounds like it's a diversion from the kind of approach that heart surgeons would usually take.
The biggest reason is that technically it probably is a little bit more challenging. It does require a lot more training for the surgeons and for the team. But here at UCSF, we have the training, we have the expertise, we have the team that's able to do it with the patient's best interest at heart. So that's why it's not done, but that's why here at UCSF, we're committed to doing that, because we are committed to doing what's best for the patients.
So Dr. de Souza, can you talk a little bit about those patients and the people who you are treating in this way? Who needs these kinds of surgeries and what kind of results are they getting?
Actually, it's a good procedure to everyone. And one thing that's really the beauty of this procedure is that we can get frail patients, like a patient that has other kind of comorbidities like lung disease, kidney disease. They are really frail, as I said, and we can perform the most safe surgery for them with a shorter recovery time expected. And it's really different from the standard approach.
And as you say, it's a much shorter recovery time as well. So then going forward, Dr. Nguyen, where do you take this from here as you start to move towards a more minimally invasive approach? What other methods could you be looking at for heart patients?
You know, here at UCSF, cardiothoracic surgery, we really believe that small incisions can make a big difference. So the next chapter for here at UCSF is to do these operations with robotic surgery. So make the incision even smaller, have a lot more control in making those small, tiny anastomoses. Use the robot to really can facilitate just a perfect anastomosis each time. So we're in the process of being one of the first programs in the Bay Area to launch robotic cardiac surgery, and we're excited about that.
Is that something that you can do, Dr. Nguyen, because you're in the Bay Area and we have access to all of this tech here?
You know, it's exciting to be in the Bay Area. One of the biggest and the only robotic program in the world is Intuitive, and they just happen to be down the street from us. So we have a very special relationship with them, a lot of collaboration to use their technology to apply to our patients.
Dr. de Souza, for those of us who are not heart surgeons and are having a little bit of trouble maybe picturing all of this, could you talk us through about it a little bit more in terms of, so we started by saying you used to have to crack open someone's chest, operate on their heart. Now we're talking about these smaller incisions where you can still get the same kind of results. Where do the robots come in? How does this logistically and physically work when you're doing it?
Actually, the robot is just a tool that the surgeon and all the team uses to perform the surgery. It's a very elegant technology, and it's absolutely safe. And one thing that is really cool on the robot use is that he can eliminate all the kind of trembling that the surgeon might have, and it can enhance your visualization because the cameras are on 3D.
Kathy, I want to add to that a little bit. So the nice thing is that in the OR, we wear glasses that magnify the operating field about 4 times. The robot, as you can imagine, has these powerful lenses, so they can magnify the operative field even more. The sutures we use are as thin as your hair follicle, maybe not as thin as mine, but as thin as your hair follicle. So you need as much precision as possible. When we operate, usually we use our hands, and our hands has so many degrees of articulation because you move at the wrists and the finger joints. But you can imagine with a robot, you have so many degrees of articulation where you can do things upside down and sideways and rotate your hand, the robotic hand, in ways that we can't do our own hands. So that's one of the powers of the robot.
And you started, Dr. Nguyen, by saying that it's a very common procedure, but something that surgeons often don't do well. Is part of that because of what you're describing, that it's just really hard to get that kind of precision when you're working with someone's heart?
Well, I think part of it is the first is the use of bilateral internal mammary arteries. It does take a little bit longer. It does take a little more technical challenge and ability to do that. And there's definitely a reluctance across the country to use bilateral internal mammary arteries. Again, we're very committed to doing that here at UCSF. In about 90% of our patients, we use bilateral mammaries.
And do you find that your patients, Dr. de Souza, are receptive to trying something that is sort of new in the field?
Yeah, they love that. When we say that it's safe and we can achieve the same results as an open chest surgery, they really go into that.
Okay, well, so it sounds like there are other options for what is usually and still remains a very serious surgery, with hopefully some options for shorter recovery times as well. Dr. Nguyen and Dr. de Souza, thanks so much for joining us today.
Thank you, Kathy.
Thanks for having us.
Dr. Tom Nguyen is Chief of Cardiothoracic Surgery at UCSF, and Dr. Rodrigo de Souza is Associate Professor of Surgery at UCSF, and I am Kathy Novak. Thanks so much for tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.